North Carolina's mental health system, it used to be state-run, but now services come from private companies. And for some families, privatization has turned into a soup of confusion that frustrates and angers these people, especially these families who really need help. After the tragedies at Sandy Hook and Aurora, everybody is talking about guns and controlling them. But why are we focused on those? Why aren't we focused on the kids who actually pull those triggers? They're the ones who committed the crime, not the gun. So I dug into our state's mental health system to see what's being done for children with issues like that, and what I found shocked me. Specialists came running to me with information. Private providers shut their doors and shut me out, and parents with open arms begged for someone to help.
I have a son, and very, very early on, I realized that he had some anger issues.
To share her story, she asked we protect her identity.
About the time that we were realizing that he was going to need some help with his anger, the mental health system in North Carolina was disbanding.
A public mental health system moving patients out of institutions and back to their communities, getting their treatment from for-profit organizations.
North Carolina started privatization with 41 mental health authorities. Those are state-funded centers created in the 70s, providing many services under one roof. After privatization, shifts in policy downsized those from 41 to 23 and now to 11 managed care organizations, or MCOs, and they oversee thousands of these private companies.
It is very complicated.
Dr. Kay McGinty is a child and adolescent psychiatrist and professor of psychiatric medicine at East Carolina University.
I'm not sure I can say it helped or it didn't help. It changed the system so much that it got even more confusing for families.
With the old system, you could walk into a mental health center and have access to it all. Bob Moore is a social worker who was part of that system.
It was very, very good. Had some marvelously qualified therapists that worked closely with psychiatry, psychology, social work. I mean, they had the whole gamut of services under one roof.
Now it's very hard to find a place where everybody's coordinated, which is one of the other barriers. So we really need to go back to working with community systems of care.
Now, without that centralized, coordinated system of care, two trends seem to be emerging. Kids are ending up in one of two places, either here in a jail, dumped into the criminal justice system, or here in an emergency department. Neither a good front line for a child with mental health issues.
Emergency rooms are very important for emergency care, but they're probably not the best place to get most of child mental health care.
Something our mom found out the hard way.
You know, I was just stunned, and I said, what do you mean? I mean, he needs to be admitted. He needs to be under a physician's care. And he said, unfortunately, what has happened is that we don't have adolescent mental health services here anymore.
Now families have to find services from one of these private providers. The managed care entity that services the East is East Carolina Behavioral Health, tasked with recruiting, managing, and paying these private providers for the care services they offer. Lisa Wainwright is the executive director.
Part of the problem was everybody was going into the mental health business. They saw this as an entrepreneurial, yes, to try and put a positive spin on it. It was, you know, an entrepreneurial endeavor. We can get into mental health. If you're not truly scrupulous, you might be inclined to serve a whole lot of folks who have very minimal needs, and not serve the people who really truly need the service.
Now here's where it gets even more complicated. I've done the legwork to try and simplify this for you. A Medicaid waiver program is being implemented in these companies right now. All across North Carolina, it should be live by July. The short of it is that these MCOs, like East Carolina Behavioral Health, become more powerful, deciding which private provider can and cannot participate in their network. It also changes when these providers get paid.
And that's freaking these providers out. I've spoken with representatives of more than a dozen of these private companies, and they don't want to go on camera. They'll talk on the phone all night long, tell you everything that's going on, but they're afraid if they speak out publicly, then they'll lose their contract with the MCO. but they all sing the exact same song. They are inundated with paperwork that takes them away from their patients. They used to get paid in 5 days. Now it could take up to 48 days, and that has some of them teetering on the edge of financial ruin. How do you pay a staff when you yourself don't get reimbursed for 48 days? And what's so sad about the whole situation is that in the middle of it is a mentally ill child. So if and or when these private companies do go out of business, that's a child who's lost its provider, its protector, the people who've helped them for so long. That is angering parents. It's frustrating them because they feel like this is more about money than it is about the mental health of their child.
Is North Carolina's mental health system melting?
No. No, I don't believe that it is. There's also, are we adequately funding mental health in this country?
Are we?
No. But there's probably lots of other things as well. And, you know, as a nation, we have to prioritize.
Wouldn't you think mental health would be pretty much near the top of the list?
Obviously, from my perspective, I would hope that it would.
I would put it back under one roof. I really cannot see how spreading it out as thin as it is can be more cost effective, at least not for quality care.
I'm hoping with this new change with the MCOs that quality of care is given more emphasis, and perhaps now that it'll be locally controlled more, they can do that.
Think about these children, you know, let's look at this from a broader perspective. Think about what's going to happen to these children. You're pulling the rug out from under them.
You think it's moving too quickly?
Well, I really don't, but I am probably somewhat in the minority on that. I think if we've been at this since 2001, it's about darn time to get it right.
And a lot of people believe we are moving in a better direction. It is just taking too long. Since we've been promoting this story, so much more has come to light. I didn't even really have time to get into the detail of that. So look for much more on this here at 9 on Your Side in the future. And feel free to email me any questions or concerns you have at jvarner@wnct.com. And if you're concerned about your own child's behavior, you have to tell somebody. Get them to their primary care physician or call ECBH, who will refer you to a qualified provider. Their information is on our website, WNCT.com.
You know, Jeff, I have to mention again, because I'm on Facebook right now talking to viewers, and they're just so appreciative that you just didn't focus on guns,
Right.
and you went into mental health, and you went really digging and looking for the issue, and it's like an onion. You keep peeling away layers.
And there are so many layers, and I do believe that's what the problem is. So I'm happy to hear from these people, and I'd love to hear from you.
That was a great story, uncovered a lot.
Thank you.
Brian Bailey is up next with your sports.